Hello, everyone, and welcome to another edition of COVID Conversations. This week, there are they are the people on the front lines of the pandemic, helping to treat and make us better. But after 2 years of treating millions of cases and hundreds of thousands of deaths, healthcare workers are telling their harrowing stories that go well beyond service and sacrifice. My guest today has been chronicling these firsthand accounts of healthcare workers of color. Dr. Yolanda Lewis-Ragland is the author of Navigating a Triple Pandemic: Healthcare Workers of Color Confront Racism in America, Health Disparities in Medicine, and the Trauma of COVID-19. Dr. Ragland, thank you so much for talking to us today.
Thank you for having me. This is a great topic, and I'm very excited and very honored that you guys are still, allowing us to tell our story because we're still in the thick of it. So,
Well, speaking of telling the story, at the beginning of the pandemic, healthcare workers were at first hailed as heroes, but behind the scenes for those healthcare workers of color, you say they were confronting and dealing with less than a hero's welcome. What do you mean by that?
as many saw, we as healthcare workers as a whole got standing ovations right there in New York City as they were coming home from their shifts. But what a lot of people didn't realize is that we were dealing with in communities of color and communities of vulnerable, residents and of need, a lot of the healthcare disparities and a lot of the devastation that we were seeing with our patients was merely because our system was already broken. So we were, having to deal with when you saw PPE, which is the protective, masks and equipment, when you saw masks and gloves and medications that were rare or scarce, rather, it was usually happening in the communities of color and in communities of need. And so we were struggling. We're still struggling. We appreciate a lot of the mandates. We appreciate a lot of the rollout for vaccines and things, but at the same time, it's been pretty obvious that the vaccines are a lot of times weren't coming to our communities first. So we found ourselves having to advocate extremely hard for our community members, our elders, our children, as well as ourselves, to make sure that we were getting what we needed to stay protected.
Many of these challenges of healthcare workers existed long before the pandemic. Tell me about what you're hearing even now from those frontline healthcare workers as it relates to dealing with racism.
Exactly. So, as we know, there are a lot of buzzwords out there now: health equity, inclusion, diversity. We're all talking about these things now. Black Lives Matter. So, the spotlight was put on, really, with during this pandemic. As crazy as bad as some of the things were with the George Floyd killing, and Ahmaud Arbery and Breonna Taylor, these things began to be highlighted, and some folks were enlightened, but many of us had already been dealing with how folks would view us. These white coats, we say this all the time, these white coats are not immunity. They don't protect us. So you walk into rooms, you walk in to give care. I'm often asked, am I the nurse? I'm often, dismissed or asked, well, when can I see the doctor? And I have to respond, time after time, I am the doctor. What do you like? What do you want to have a conversation about? But people make huge assumptions. And, when you're dealing with just sort of the trauma of what is going on outside of medicine, we're affected by that. So we were all affected by George Floyd and Ahmaud Arbery. I'm the mother of a 20-year-old, black male, and at the time he was 19. And I remember one of the reasons we started the book and the book series for me was because I myself was having mental health concerns and issues and depression. And I was definitely I had PTSD. I was scared for my own son to walk out of these doors. He doesn't have a badge that says my mother's a doctor. We're all educated. We're all, college educated. We have this income. No one's walking around with that. He's a young boy, decides he likes it, and he has the right to wear, dreads in his hair, skateboarding. I still see him as a young kid, but I had to have conversations over and over. You're not seen by the rest of the world the way we see you, particularly, police officers and residents of communities. And so, we were all afraid. And so we were dealing with our own trauma of how we were handling what's happening in Black America. But we had to walk into our clinics and our offices each day, with the S on our chest, like, how can I help you? When really, we needed people to ask us how we were doing.
Mhm. Speaking of the Black community, we are constantly hearing reports about the toll COVID is taking on our community. Why do you believe that this remains a problem?
Well, the truth is, again, the system was broken. And, you have some that will say the system is not broken. The system was designed not to care for certain individuals, to leave individuals out. But, in my optimism and in my belief that we can and do make a difference, the system is broken. It doesn't serve us all, just like the justice system doesn't serve us all equally. The healthcare system doesn't serve us all equally. And so the pandemic began, what was happening is that it was catching up to us that we were already leading the nation in many chronic illnesses like heart disease. 40% of African American adults have uncontrolled hypertension. 40%. There's studies with the NIH, the Office of Minority Health, that says 60% of African American women have heart disease of some sort. The American Heart Association says that 49% of African American women have heart disease by age 20. So we were already dealing with leading chronic illnesses like heart disease, diabetes, actually mental health concerns like depression, anxiety. And so here comes the pandemic. And it actually was attacking those that were weakest, our elderly, but also those who had heart disease, who had diabetes, who had cancer, other chronic diseases. And then with the isolation and what was happening with that, us having to hunker down and be home and sort of social distance, it began to take its toll on those with mental health concerns. And so, with all of that wrapped up, here you are with the community that was already very vulnerable. That's why I keep saying the vulnerable communities, very vulnerable to any attack. And then a pandemic attack meant that we were being plucked off. You have a herd, all of those at the weakest on the outside get plucked off first, and that's what was happening to the to communities of color with these chronic issues.
Mhm. The frontline workers over the past year and a half or so have often complained about the rise in cases because of the unvaccinated, for example. Do you find this to be particularly uh, severe in the Black community, or is that not a factor when it comes to the treatment of African Americans in the midst of this pandemic?
So I think that in the beginning it was definitely a factor. I think that we are skeptical, and we have the right to be skeptical because there's been a history of exploitation of African Americans. Everyone can cite things like this Tuskegee experiment. There's all these things that people would take into heart. And, white America has to recognize they have to take accountability for that. So when people were skeptical, it was very much understood. And so we were very active, and I'm still very active in making sure that our residents, our communities understood that we were a part of the solution this time. I think many times in the past we've been left out, but here you had Dr. Kizzy Kromecki. We had all of these folks who were a part of the solution. So I think it was a little bit more palatable. I will say that we still have individuals that are skeptical. A lot of this disinformation and misinformation, it really hard to combat. And the less, you know, the less education you have, the more likely you are to fall for misinformation and disinformation. And so it really has become a literacy issue in many areas, as well as a cultural issue. But I do believe that we've made great strides in the Black community. But I think the biggest help has been conversations like these, individuals like you that look like us and feel like us and have compassion, looking for providers who look like me and can relate. I think this is what's making the difference. So I say it all the time, the messenger is as important as the message in this particular case. And so I think it is because we have been connecting as a community with you all who are very active in combating this disinformation and the misinformation and getting our families safer.
What are your medical colleagues, the other doctors telling you about disparities in medicine and why this is something we should be paying attention to even now in 2022?
I mean, the truth of the matter is disparities in medicine it really is a much broader spectrum than people realize. So we talk about social determinants of health. Social determinants of health are not just the things that happen medically, right? So housing, that's a social determinant of health. If you have poor housing, if you have pollutants around you, if you have environmental areas in your, so for instance, we're talking about wards 7 and 8. I talk about these all the time. And you have toxic sites and waste sites and the landfills. It's affecting your physical health. So housing, environment, employment, unemployment particularly, these are all social determinants of health. So health disparities, we have lack of access. Ward 8 is the only federally determined, is a federally qualified area of mental health shortage, especially for our children. When you think about that, 50% of the children in the District of Columbia, roughly 48% of District of Columbia, reside in Ward 7 and 8, but we have a mental health shortage. So for upwards of 20,000 children, there are only 8 mental health specialists, and only one is actually designated as a pediatric specialist. In Ward 3, for instance, has 10,000 children. They have 20 designated pediatric mental health specialists. So we have very specific lacks of access to care. We also have food deserts, lack of access to healthy foods. We have unemployment. We have poor housing. Of course, there's violence, gun violence, domestic violence. There's, when I talk about so many things, there are several areas, and of course, the justice system. So these are all determinants of health. So health disparities, I think, is a misnomer because people think it's just about diabetes and heart disease and cancer, but it really isn't. It's about your education, your housing, your justice system, your ability, and your access to food, your access to healthcare. All of these really determine your disparity of your health status.
Let's talk a little bit about your book, Navigating a Triple Pandemic. Why did you specifically choose this topic?
Well, so thank you for asking me that. So the concern and the issue was this: the pandemic hit, and we were all talking about this pandemic, and the pandemic was at the time just COVID, but the recognition was we were already in a pandemic. We were in a pandemic of racism. Racism was happening right around us, stifling us, the metaphoric knee to the neck, we couldn't breathe. All of these things were happening around us, and no one was paying attention. And it's like they don't pay attention to the house until it catches fire. So no one was paying attention until the eruption, people in the streets and people marching, because we watched on film. And this isn't the first time we watched a Black man get nearly murdered on film. Some of us can date ourselves, and we all watched with the video of Rodney King and thought, oh, it's very clear they're going to do something about that. When we saw the George Floyds and, and the Ahmaud Arbery's, when we saw these things sort of happen before our eyes, I'm going, this is already a pandemic. We're already on fire. This house is on fire. Why are we all of a sudden, concerned about saving America or even the world when it came to this disease, when part of the reason we're suffering from this disease is because the second pandemic, which is the health disparities, is what makes us more susceptible even to the pandemic, right? And so those wrapped up, this racism, the health disparities that already put us in the jeopardy of being susceptible to the COVID virus itself, was just it was a triple storm, right? It's like all of these things were perfectly lined up, and of course we were going to be devastated by just one more blow. And as medical providers, nurses, and I don't know if people know, but the book isn't just doctors, it's nurses, doctors, pharmacists, physician assistants, all of us that are on the front line, recognizing that we're all in this together, and we needed to pull together and really figure out how to educate our community so that we weren't walking away from vaccines and from medications that could save our lives, especially being as vulnerable as we were as a community.
Where can people find out more information about your book?
So, all the books are on Amazon. This is a series. We have 3 volumes of the healthcare workers. I actually did an educator's edition because I also recognize that we weren't the only ones on the front lines. The teachers were on the front lines, and with the digital divide during the pandemic that was recognized, it was already there, but here we go recognizing things again because of the pandemic. The teachers, and these were African-American teachers that we spoke to, also had to pivot and figure out how to save their children in this academic achievement gap. And so that's also one of the books that we did, but they're all on Amazon. I'm on dryolandamd.com. People can reach out to me on both Instagram and Twitter. I'm Dr. Yolanda MD. And so any way that they want to connect with me, I'm always willing and honored to connect with someone and just have this exchange of information. And really, this is just about keeping our communities safe and giving as much true information and education as we can, because again, we're combating so much misinformation and confusion, as you all know, with CDC. New guidelines and rules are always coming out. I'm a part of a group called the Black Coalition Against COVID. And so we do a lot of education. We've developed an app for individuals who are looking for their areas of places where they can go for either testing or vaccines or just information. And it's beyond COVID. We're doing a lot more, obviously, because we're going to eventually get past this. But we don't want to have to repeat this again, because you already know if you don't learn from something, you're going to repeat it again. So we're trying not to do that.
Dr. Yolanda Lewis-Ragland, thank you so much for talking to us. We appreciate your time.
Thank you for having me again. Have a great day.
You too. And thank you for joining us for another edition of COVID Conversations. Make sure you tune in every Wednesday at noon as we discuss all issues related to the pandemic. I'm Harold Fisher. Have a safe and healthy week.